Safe sanitation is key to achieving many public health outcomes, and ending open defecation is necessary in order to achieve safe sanitation. However, historically in India, many people have preferred open defecation to using latrines, even when latrines were available. The Government of India's Swachh Bharat mission has taken the challenge of open defecation very seriously and has recently declared the country open defecation free. The campaign emphasizes generating awareness, sharing information, and creating behavior change to bridge the gap between latrine availability and latrine use. With the support of the Bill and Melinda Gates Foundation, 3I supported an evidence program to identify effective approaches for improving latrine use among those with latrine access in rural India. The program supported 9 formative evaluations and 4 impact evaluations of low-cost, innovative, behavioral science-driven interventions to promote latrine use, over and beyond the Swachh Bharat mission.
The primary reason the program was funded was to understand what type of interventions are effective at reducing the rate of open defecation in rural India. From the perspective of the Gates Foundation, we were quite interested to learn about that, because we have accumulated, not just we, but the sector has accumulated a body of evidence suggesting that exposure to open defecation is very bad, particularly for kids.
In each of the 4 states, formative studies revealed unique barriers to latrine use, including habit and socialization, negative attitudes to latrines, and fear of pits filling, among others. People simply were not comfortable in their latrines and therefore chose not to use them.
Our research sort of mapped reasons for why people weren't using toilets in the first place. These were around anxieties about who would empty a pit, how quickly a pit will fill up, convenience, etc.
To address these concerns, the study teams developed behaviour science-informed interventions that targeted local barriers to latrine use, including knowledge and anxieties around latrine use. In all 4 states, the Swachh Bharat mission contributed to a surge in latrine use between baseline and endline. In Karnataka and Odisha, there was significantly larger increase in latrine use among those exposed to interventions than those who did not receive the interventions.
We found tremendous increases in latrine use in Raichur district, Karnataka, where our study was done. And the Ranas intervention was able to further increase latrine use to almost 97%. So the added value of the Ranas intervention was to reach the most change-resistant individuals.
The variation in impact may be related to the type of interventions or the gender, caste, age, and identity of the participants. At the end of the study, latrine use rates varied by sex and state, among other factors.
I think especially a lot of the initial messaging around SBM was more targeted towards women, and that was pretty strongly seen. So men and even older women didn't necessarily see it as useful for them. They saw it as emergency toilets that they use when they're sick. But of course, amongst younger women, it was pretty preference for toilet use, both amongst them and their family members, was high for younger women. It was a matter of security, of shame, etc.
In Odisha, the intervention led to a significant improvement in safe disposal of child feces amongst latrine-owning households.
So what we did in Puri district in Odisha, India was have a multi-level intervention that had community level events as well as a mother's group meeting as well as some household level events. And what we found was that latrine use changed in both control and intervention communities. We also found that our intervention also looked at child feces disposal. And so a bigger result is that in both communities there was a reported increase in safe child feces disposal behaviors.
In Bihar, the intervention improved households' correct estimation of pit filling rate. However, qualitative research showed that households were emptying undecomposed fecal matter from pits, undercutting the public health benefits of latrine use.
Latrine use is very important, and it's particularly important for where we are in India today, that we've had a huge sanitation program that has shown tremendous success. But in order for us to really reap those benefits and sustain the changes and the benefits that we've been able to bring about, that we need to continue that focused attention on why latrine use is important for policy as well as in terms of actually on-ground implementation.
As India moves into its next phase of Swachh Bharat mission, in which sustainability and fecal sludge management will be key, emphasis needs to be placed on behavioral determinants of proper sanitation in addition to the physical restraints. The evidence from 3I's Promoting Latrine Use in Rural India evidence program suggests that for a sustained and consistent latrine use, we need to move beyond the traditional information, education and communication model and address context and gender-specific behavioral determinants.